Botswana, a landlocked country in southern Africa, is one of Africa's success stories. Since achieving its independence in 1966, Botswana has experienced dramatic economic growth. Botswana is today the largest exporter of gemstone diamonds in the world. Its economy is also fueled by beef exports to the European Union, eco-tourism, and more recently, financial services. Botswana's economic success has been bolstered by a stable political and economic system.
That I will maintain the Constitution of Botswana and uphold the laws.
The HIV/AIDS epidemic, however, threatens to reverse Botswana's political and economic gains. Since the first case of AIDS in the country was diagnosed in 1985, it is estimated that today, in 2008, 17.1%, or 291,000 of Botswana's 1.7 million people are living with the virus. The hardest hit being its young adults and women, the most economically productive segment of the population. Most distressingly, over 51,000 children had been registered with the National Orphan Care Program by July 2006, largely as a result of HIV/AIDS. A situation of this nature requires a coordinated and sustained comprehensive intervention. Power of partnerships, voices from the field.
Ramogai, as you know, is one of the few presidents in the African continent who came out openly, and said to the world, yes, we have a problem and we need to be assisted. And I think it all started from there.
Having declared HIV/AIDS a national emergency in 1999, Botswana's then president, Festus Mogae, formed the National AIDS Coordinating Agency, NACA, to manage the nation's multi-sectoral response to the epidemic. NACA then joined forces with HAP to collaborate on the design of an effective strategy to support the nation's response to the epidemic. This became, in March 2003, the National Strategic Framework for HIV/AIDS, NSF, Botswana's visionary and mobilizing blueprint for addressing the nation's HIV/AIDS emergency.
HAP's contribution to the fight against HIV/AIDS in Botswana has been unique. It has been unique in the sense that I think a lot of resources have been put at the disposal of government to be able to fight this scourge. And secondly, it's not only the resources financially, it's also provision of technical assistance.
HAP, the African Comprehensive HIV/AIDS Partnerships, is a country-led public-private development partnership between the government of Botswana, the Bill and Melinda Gates Foundation, and Merck & Co., the Merck Company Foundation, dedicated to supporting and enhancing Botswana's comprehensive HIV/AIDS response. The Bill and Melinda Gates Foundation and the Merck Company Foundation have each donated $50 million towards the project. Merck & Co. is in addition donating 2 antiretroviral drugs, Stokerin and Crixivan. HAP's strategic objectives are to scale up HIV prevention, expand HIV counseling and testing, continue support of the National ARV program, mobilization of the community and people living with HIV/AIDS, PLWAs. HAP's vision is to be a model public-private development partnership in the global fight against HIV/AIDS.
In terms of really its contribution and the easiness of working with an organization that is small, with less bureaucratic process, and a private sector that is much more reactive, has been a major contribution to the national response.
This is a very unique type of collaboration between one government and two private foundations. And this is a model actually that we need to learn from and see how we can replicate the model in other countries.
8 permanent secretaries from the Botswana government, the HAP Board of Directors and the HAP Managing Director formed the Madikwe Forum in 2004.
Putting the Madikwe Forum in place made a big difference between the time when it was in place and when it was not, because now you're able to discuss things at a policy level. The government is able to provide direct policy guidance to the initiatives and ideas that we have as an organization.
It's an enrichment of the partnership itself. It has provided everybody with an opportunity, to share, information, to share, ideas as to how we could resolve certain problems.
The forum is to me, now become a group of friends. It is working very well because we share a common vision as the partners, as the partnership. It's working very well because we determine the programs together. It's working very well because we also monitor implementation of this program together.
It also has a useful subcommittee, which is called the Implementation Review Committee, which now deals with the much more operational issues of implementation, so that in the end you can really be involved in things at a policy level and deal with some of the operational issues relating to implementation.
In January 2002, the government of Botswana, with support from HAP, took the bold step of launching Africa's first national antiretroviral program, MASA. MASA, a Setswana word meaning new dawn, heralds the rising of a dawn over Botswana's struggle against HIV/AIDS. Through the program, the government of Botswana provides ARV therapy to its citizens in need of the treatment free of cost, the first nation in Africa to do so. The MASA ARV program remains the largest public treatment program in sub-Saharan Africa. It has demonstrated that a large-scale treatment program is feasible in developing countries. The funders chose Botswana because of its high prevalence of HIV, its economic and political stability, and the government of Botswana's commitment to fight the disease.
Botswana has been enormously successful, possibly the most successful in all of Africa in terms of treatment levels. Something on the order of 85% of all people who need treatment are on treatment, with wonderful adherence levels, compliance rates, similar or greater to many Western countries.
MASA has been a great success. It was the first program of its kind on the African continent. For the first time, an African country actually took it upon itself to pay the vast majority of the cost of care for a truly national ARV program. And we are continuing to improve the cost effectiveness of the program.
When we started the treatment program, the cost was around $1,600 US per patient per year. And currently the cost is around $400, and the goal is to bring it down again.
A critical first step in building the necessary infrastructure to support ARV rollout was the training of those healthcare workers who would deliver the medicines to the people. Since 2001, HAP has provided significant financial and technical resources to support the Kitso AIDS Training Program, the government of Botswana's national antiretroviral therapy training program.
Before the program started, there weren't healthcare workers in the Botswana healthcare system who were trained on providing ARV clinical care. And what the program has done is it has trained almost 5,000 healthcare workers who are now able to provide treatment in every district of the country. And there are also lay personnel who have also been trained, making the total of people trained in this program over 7,000. Without having had this training contribution, it would not have been possible to roll out the program as rapidly as possible and also provide access in every district of the country.
Providing ARV therapy and building volunteer testing and counseling centers, while very successful, were not encouraging enough people to test. After multi-level consultations with the community and key partners such as HAP, the government of Botswana introduced routine HIV testing in January 2004, where an individual is tested on an opt-out basis.
It has really made it increased very considerably, the number of people who've then subsequently, after knowing their HIV status, got to access prevention programs such as the PMTCT program and also the National Treatment Program. And currently, over 90% of people who are offered an HIV test in the routine HIV testing program actually accept to have one.
Mother-to-child transmission is remarkable, having gone down from 40% to 4%. A lot of this has to do with the wonderful routine testing with opt-out provisions that Botswana has implemented. So there's been a number of success stories. A lot of these success stories can be modeled in other countries and adopted in other countries, and already have been.
In an effort to fulfill the mandate of the National Strategic Framework and to bring Botswana's HIV/AIDS response closer to the people of Botswana, HAP decided in late 2004 to support the HIV/AIDS responses of 7 districts after consultation with the Ministry of Local Government. They are Chobe, Francistown, Ngamiland, Khansi, Siruwe Palape, Mabutsani, and Silibi Pikwe. HAP's support to the districts was driven by a need to steadfastly increase the pace of rolling out programs to communities, thereby ensuring greater coverage and impact of the National Strategic Framework. This would also ensure that specific attention is paid to the local issues that are best understood within a smaller unit, such as the district. The District Multisectoral AIDS Committee, DEMSAC, therefore forms an appropriate channel through which HIV/AIDS initiatives are developed, fine-tuned, and implemented. Francistown has one of the highest prevalence rates in the country at 37%. From a population of 93,000, an estimated 24,000 people are living with HIV.
Most of the activities that HAP is rendering here, they are purely for prevention. So we have come out with a program called Prevention with Positives.
I'm an acting lead focal person for a network of support groups. So in this group, we also have got lay counselors, which are being attached into 5 clinics around Francistown, whereby there's a rollout of ARVs.
The lay counsellors that are placed in the IDCs are very helpful because they are in the same boat with these patients, and as a result, that is how the patient now see themselves as taking treatment accordingly.
Another initiative that DEMSAC has embarked on is the dissemination of information by groups such as the Ghetto Artists. Ghetto Artists is a non-profit making organization that uses live performances to disseminate information on HIV/AIDS and other challenges facing the community.
We were one of the first sites to start providing ARVs because in a way we are at the epicenter of the HIV epidemic in Botswana. Currently we have about 24,000 people who are living with HIV, and our infectious disease care clinic, we are currently following around 11,000 people who are on treatment. The building that we use at the moment is called the IDCC, the Infectious Disease Care Clinic. It was built with funds from HAP. And in terms of human resources, what HAP did, they brought in preceptors. These were HIV specialists, nurses, doctors, pharmacists. Initially, paraload could only be done in our center and in Gaborone. But with support from HAP, now we're able to do viral loads in different parts of the country. Also, CD4 counts can be done, even in clinics at the moment, thanks to assistance from HAP.
The MCDA is a non-governmental organization established in 2002 as a community-based AIDS project.
The project initially started with 20 peer educators only. The main purpose was to prevent HIV/AIDS. When our target group was mainly the underprivileged groups, marginalized, which were commercial sex workers, unemployed out of school youth, and long-distance truck drivers. We actually work with outreach programs. Here we are talking about where we have peer educators either having meetings in the community. It could be in the bus, it could be in the shabins, it could be in the public areas, it could be in homes. We just identify homes and then from there we talk. At the end, we have like group questions and then one-to-one, because there are sensitive issues. One would even want to nicely come and identify certain things. So then these issues are clarified there and there. But then some of the difficult issues, they are referred to the office. Then we go and address those.
So we are going to take time to change the behavior of Botswana. In all, I can say that we are making a progress.
Silibi-Pikwe is a copper and nickel mining town located in the northeast of Botswana with a population of about 50,000 and the third highest HIV prevalence rate after Chobe and Francistown districts at 23.3%.
I'm an ACHAP program officer who is based in Silibi-Pikwe since 2006. The DIPSI has a plan that every year they put forward for implementation, including all the stakeholders sitting together to plan, and they come up with one comprehensive district plan. My duties here is to assist to provide technical advice to the implementation of the district's response to HIV/AIDS.
But first of all, maybe for
as a highway for neighboring countries like Zimbabwe and South Africa, many of the trucks that pass by, they pass through Silibi-Pikwe. So we have got a number of sex workers around. Many people are having more than one sexual partner.
Ignorance is still there. That's why we are still trying to fight the ignorance, and people are still buying sex. Some are married, but they're still buying sex. We distribute condoms, but STIs and people who are infected, the numbers are increasing.
More people, there is a system that I call a triangular one. Small house, small house, you went again. And then boya. At the end of the day, we held on
Every time you encourage people to say that you should go out there to mobilize communities, when they come to receive now, to demand the services that you have called the people for, they find there's nothing that they can receive.
Positive Living Help Ourselves. It's a community-based organization, and it was formed by people infected and affected by HIV, living in Silibi-Pikwe and surrounding villages. And the main objectives was to have a forum where these people can come in and share experiences and even get information on HIV and AIDS so that they can access the available resources.
Before I joined this support group, I was so stigmatized by my in-laws. So that is when I stand up and I stand by myself to consider this virus as any other diseases.
Hello, my name is Lebalang Otsidile. I'm a peer mother volunteer based in Tapologon Clinic. Our core activity is to share experiences, how we have successfully enrolled on PMTCT and how we have benefited on it. Then we encourage all these women to do the same. We offer psychosocial support and ongoing counseling to HIV positive pregnant mothers who have come for ANC in the facility.
Lenaneo le ne la re sologela mosola ka gore ne ra nna le ngwana o ne a tsena sekolo la ntlha o ne a breaka ka ngwana yo wa ntlha mme a re mo isa gore ke ra chekiwa sengwe le sengwe ka wa ntlha a ba siame he yaanong ga re leka go ne a na le mme o ntse a mo tlhokometse gore o dira ditsarete tsa o di a go tswa di sa siame ke gone mme wa batla gore rulaganyetsa ka gore nnyame kana la ile gore go iphetso go ntse jalo ga go sana bothata gompieno a bo mme wa re itlhalosetsa gore le ene le gare ga o na le ngwana mme o le ene botshelo ya go ke jone jo mme ga gona bothata botela ga ile gore ka latelela ditsamaiso tse di tshwanetseng tsa teng.
Mabutsane is a sub-district within the larger southern district of Botswana with an estimated population of 15,000. The HIV prevalence rate in Mabutsane village is 14.78% and 21.43% among the pregnant women of the village. It is a sparsely populated district and is among the least developed parts of the country. The district's main economic activity is subsistence livestock farming, and the government of Botswana employs over 90% of the workforce. It also has very limited healthcare facilities and few doctors.
Clinics are far apart. Kokong is 80 kilometers away, Kakia 60 kilometers away, and so far we only have one pharmacy technician.
With the help of ACHAP, they managed to provide 2 doctors. They managed to provide initially 3 nurses, and right now the staff that has come from ACHAP also include a data entry clerk, it also includes a lab technician, and it also includes a pharmacist. When it comes to other resources like this structure here, the Mabutsane IDCC, it was actually constructed by ACHAP, fully finished, and at the moment we have received lab equipment because we are hoping to also be running a lab service. Mabutsane IDCC, it is fully rolled out, as in it's offering all the services that an HIV